If breastfeeding has been going well, but your baby is suddenly refusing to nurse, they're probably going through what is called a nursing strike. Although a nursing strike can be a very stressful phase on a breastfeeding journey, it is almost always temporary. In today's video, I would like us to look at some practical steps we can take to overcome a nursing strike. Hi and welcome back to my breastfeeding support channel. I'm Regina Kincaid, a midwife, international board certified lactation consultant and mum of 5. Although not unheard of, it is unusual for a baby to self-wean before the age of 1. So if your baby is suddenly refusing the breast, you're most likely dealing with a nursing strike. And nursing strikes on average last a few days. The La Leche Leak suggests that most nurslings will be back to breastfeeding within 2 to 4 days. There are two very important things we should continue doing during the nursing strike. The first one is feeding the baby. That's pointing out the obvious. But we want to sustain the baby throughout the nursing strike, preferably with expressed breast milk. And this can be given depending on the baby's age by cup feeding or spoon feeding or pace bottle feeding, so that they are not developing a bottle feeding preference. The alternative feeding methods, they will also avoid the development of a bottle feeding preference. But if you don't feel confident with the alternative feeding methods, then perhaps seek support from a lactation consultant or go with the pace bottle feeding. The second essential is to protect and maintain your milk supply through expressing. And whilst some mums are very confident and efficient with hand expressing, a lot of mums would rely on pumping, and you would need to pump as frequently as your baby nursed, or even a little bit more frequently. Nurse before the nursing strike so that you're not experiencing a drop in milk supply, and also that your milk is being moved along so that you don't develop blocked ducts or mastitis. Often but not always, a nursing strike is triggered by an external stressor. Whilst you won't always find out the reason that caused the sudden breast refusal, here are some of the more common causes. The first one being is that your baby is unwell. They may have a stuffy nose or oral thrush or an earache, so an ear infection, that suddenly the position they would normally nurse in is that they're uncomfortable in that position, and it's painful for them. Your baby may be teething and baby's gums may be too sore to suck, and baby is chewing on the breast rather than sucking. The baby may have accidentally bitten you, and your reaction to that unexpected bite may have confused the baby and left with some negative associations, although it's very understandable to react abruptly when you suddenly are bitten in the breast while breastfeeding. Nursing strikes can also happen in response to a drop in milk supply, or indeed to an oversupply or an overactive letdown when the breast milk is flowing too fast and your baby is just overwhelmed with that spray of milk. A drop in milk supply could have happened through a change in feeding pattern, or sometimes during the time of ovulation. Some mums experience a dip in milk supply, which is usually temporary. It is due to the changing hormones throughout the cycle, or indeed through a new pregnancy. Babies who also receive a bottle frequently in addition to nursing, they can develop a bottle feeding preference, especially if the bottle is given more in a traditional way, where the bottle is held vertically more than horizontally. And if a fast flow teat is being used, then the babies can get used to the fast flow on the bottle, and they will expect that on the breast as well, and they're not so used to having to work and suckle to trigger a milk flow. You know your baby best, and you may be able to get to the root cause of the nursing strike. But no matter what the cause, a nursing strike can be usually very stressful and upsetting for everyone involved. So try and get some support so you can have some time with your baby and focus on your baby. It would also be advisable to get your baby checked out by your doctor so that you're sure that there are no underlying health issues for that sudden breast refusal. Back to basics really is the approach to a nursing strike, no matter how old your baby is. If you think about after your baby was born and the skin-to-skin contact you offered then and how it helped the baby with establishing breastfeeding, now you can offer skin contact in a non-expectant way with no pressure to help them get back to breastfeeding. So when you're offering the breast, put your baby to your bare chest, but you can also play in with no pressure with your baby, for example on the bed with your top off, so that there is no pressure on the baby to feed in that moment, so that they can explore the your chest and your breast and get some interest back in breastfeeding. Another lovely way is to take a warm bath with your baby. In the bath as well, with the warmth, you may get a letdown and your milk may start to flow, which then is an extra benefit to the skin-to-skin contact when your baby realizes the milk is there and it's readily available and it's flowing. Remember that your baby is not rejecting you as a parent or as a mom. They may have temporarily had a negative association with breastfeeding or felt uncomfortable in a certain position. So what we're trying to do is make breastfeeding pleasant and comfortable for them again in a no pressure way. So if you're offering and your baby is upset or unhappy, then stop, calm them, stroke the baby, offer lots of cuddles, recenter yourselves. This is a great position for recentering. I've also previously done a video on how to recenter yourselves if breastfeeding or trying to latch the baby is becoming stressful, which I will link here in one of the cards. But yeah, so we'll stop and cuddle and then try again for the next feed. So time, patience and persistence are key. So with each feed you can try to offer the breast 3 times and be persistent with that. So at the beginning of the feed, when your baby is ready, and it's important again to follow the early hunger cues so that your baby is not crying because they're so hungry. So kind of watch the baby when they're waking and they're probably still a little bit in a drowsy state. They tend to take the breast better then, because when we're awakening or when we're in a drowsy state, our mind is in a more primitive state, and as breastfeeding is important for survival, they may be more receptive to taking the breast then. So you offer the breast at the start of the feed. If your baby gets uncomfortable and gets stressed, then you can offer the bottle with pace bottle feeding technique. And then when they filled up a little bit, they have kind of quenched their initial thirst, sort of halfway through the feed, you can offer the breast again. Perhaps even at that point try a different position if your initial position, if the baby wasn't happy in the initial position. And then again, if they're getting upset, crying, if it's becoming too stressful, calm your baby, offer the rest of the expressed breast milk with pace bottle feeding. And then at the end of the feed, you can offer the breast again and see if they're ready to take the breast at that point. So try to offer the breast 3 times with each feed. If you find that latching is unsuccessful, you could put your baby in a sling and try and rock your baby in a sling and offer your breast while the baby's in the sling. If you find that too difficult with the carrier, then you could just stand up or even like sit down and rock your baby while you're offering the breast, so the motion sometimes helps as well. Also dimming the light and withdrawing yourself into a quiet room where there's not a lot of For an older baby, taking them along to a breastfeeding support group where they see other nurslings can lead to behavior copy and your baby or toddler becoming interested in your breast again as well and seeking the breast. Be consistent and take 1 feed at a time. Seek support from a lactation consultant or healthcare professional, especially for ruling out any underlying health issues that may cause the nursing strike. Finally, if the nursing strike goes on and days turn into weeks, your baby may signal you that direct breastfeeding is coming to an end. And in that case, you may want to decide to continue pumping for a little bit longer so you can continue to provide breast milk for your baby, depending on your baby's age. If you've got a toddler, then maybe they're signaling that yes, it is their time, that they have decided to self-wean if they're not coming back to the breast. If this is a start of a new chapter in your relationship, please again be gentle with yourself. Remind yourself what you and your child have achieved together, and mind yourself as you're moving on to the next phase of parenthood, especially as your milk supply is dropping and hormones are changing. Each breastfeeding journey is unique. If you're affected by the topic mentioned in this video, please don't hesitate to reach out in the comments, like and subscribe so I can continue making more breastfeeding support content. And otherwise, until next time, bye for now.